The language barrier of travelers arriving in the country and the provision of correct location addresses are seen as one of the challenges of the screening process for coronavirus at the Kotoka International Airport. Travelers are expected to fill a health declaration form on arrival and are scanned for symptoms. Officials from the Ministry of Health, the Ghana Health Service and Port Health led the team of journalists to witness the screening process at the points of entry. As part of the rules of Port Health, which is to safeguard the import and export of diseases of international threat, officials are also to ensure disease control and surveillance, food hygiene and safety, vector control, and port sanitation. About 2,000 travelers are set to arrive daily in the country and are expected to be screened on arrival, but first need to fill a health declaration form. It requires the traveler to provide travel details, residential address, and symptoms of fever in the last 2 weeks.
Before you cross the land, the thermal scanner will pick your temperature. It's here to check or to monitor the temperature. If the temperature is above the 37.5 degrees Celsius, that means we have a problem, health problem. So quickly, one of our officers have to isolate you from the queue. We have the isolation bay here. We interview you further. Then we use this one to recheck the temperature at the isolation bay. If the temperature is still above the 37.5, we have a team here, Port Health, Airport Clinic, and the ambulance service. Quickly, we have to notify all those people. Then we notify the International Health Regulation focal person. We have entrance to the tarmac. From there, ambulance will come and pick the person and transport the person to Ridge Hospital.
Those wearing glasses must remove them before screening. Although the procedure is not time-consuming, there are other challenges.
A language barrier is number one. Then education. Some of them, they cannot fill the form. So when they come, they try to create confusion because they cannot fill. Some of them will say, in Ghana, you say, you see, because they feel shy when you look at the way they have dressed, but excuse to say, they cannot read and write. So they try to bully their way, but if you are not able to fill this form, we'll make sure you not cross the line. We have our security personnel here, so we'll make sure you will not allow you to enter our territory. We'll make sure you fill the form before we take your temperature.
The head of Port Health at the Ghana Health Service, Dr. Dennis Laye, said a bay is allocated to quarantine any persons showing symptoms when they arrive. He said the public must adhere to personal hygiene rules and observe preventive measures.
There is no cure for this disease condition. So prevention is our only weapon, and we need to drum that home to the general public.
Travelers who provide false information, Dr. Laye said, will be handed over to the appropriate security personnel. Since the World Health Organization declared the outbreak as a public health emergency of global concern, countries have been told to hold themselves in readiness to curb its spread.